Welcome to the Anxiety Coaches Podcast, a relaxing and informative show where we explore anxiety, panic, and PTSD, sharing how you can overcome them for life.
Aloha! Welcome back to the Anxiety Coaches Podcast. I'm your host and coach, Gina Ryan, and I am so happy to be with you again today as together we can consider the many ways to bring your mind and body back to its natural peace and calm. In today's episode, I'm talking about throat symptoms and anxiety's influence on Globus sensation and LPR. Now that's a mouthful. And what is LPR is probably what you're asking, because I know most of you listening might be familiar with the Globus sensation, which is the lump in the throat sensation that we often get with anxiety. And LPR is Laryngopharyngeal reflux. We're going to call it LPR here today. And that is when you have throat symptoms that are related to this reflux that can happen. Now, throat symptoms related to anxiety are commonly referred to as the Globus sensation or Globus pharyngeus. Now, these symptoms can manifest as a persistent lump or tightness in the throat, a feeling of something stuck in your throat, having difficulty swallowing, or feeling the need to clear your throat frequently, like that there's some mucus in there or something is stuck and you want to keep trying to clear your throat. Now, while these symptoms can be distressing, they are typically not indicative of serious medical conditions. But as always, it's important for me to tell you that if you're experiencing persistent or severe throat symptoms and you haven't had it checked out already, you should check it out with your healthcare professional to rule out any underlying medical conditions that could be possibly easily corrected and not have to be concerned about it any further. My story is that I have had both of these things happen to me. I had the Globus sensation back in the day when I was living with anxiety and trying to pull myself up and out of the wormhole. Throat was a big place that my anxiety and stress lodged. I would feel like I had a lump in my throat, and that concerned me, so it only got worse. I would worry about it, and then it would get tighter. Of course, I was always able to breathe. I never had any problem like that, but I was afraid of it. And what it was is just my stress. It was how my body reacted. A place, some people have stress in their neck and shoulders, and I had it in my throat, that Globus sensation. And it was very, very distressing for me. So if you are experiencing this, I totally feel you because it can feel scary. And then on the flip side of that, I have also had LPR, which I ended up having after having COVID in 2019 and early 2020. A lot of people here on Maui were sick with COVID before anybody knew what COVID was. But I was sick for quite a while, and I had symptoms that lasted for a really long time. It turns out I wasn't coughing anymore from my lungs. I was coughing then for what my doctors called silent GERD. And I couldn't understand, how can I have GERD? How can I have acid reflux when I don't feel that? I have no indigestion. I don't have the fiery belly. So they explained it all to me, and where I was manifesting the problems was farther up. I had it up in my laryngopharyngeal area. So that is where I was suffering. And I was able to take care of most of that using the Acid Watchers diet and other lifestyle changes to ease the GERD and settle all of that down. That's all very understandable, and you can find out more about that online if you have these symptoms yourself. It's great to look into. But I could feel the difference because I had Globus when I was anxious, and I had this LPR which when you hear me describe the symptoms later on in the show here, I still have some of those if I eat triggering foods. So mine is not now related to anxiety, although I know that if I were to get very anxious, if I were to start having stress on top of stress on top of stress, maybe my body would go back to having the Globus feeling again if I were to be anxious all the time. So the exact cause of throat symptoms related to anxiety is not fully understood. However, anxiety and stress can contribute to physical sensations in the throat through several mechanisms. So this is what we want to be aware of so we don't feel so frightened of these things. And the first one is muscle tension. Anxiety can lead to increased muscle tension, including the muscles in the throat and the neck. This tension can result in a feeling of tightness or constriction, and these sensations can show up in your throat, muscle tension. The second one is hypersensitivity. Anxiety can make people more attuned to the physical sensations in their body. And this was me. I could feel everything that was going on in my body. And let me tell you, that's a pain in the neck. This heightened awareness can make normal sensations in the throat, such as swallowing or the presence of mucus, feel more noticeable and therefore bothersome. Third one, increased swallowing frequency. When we're anxious, some individuals may swallow more frequently or forcefully. This excessive swallowing can create a sensation of a lump in the throat or the need to clear it frequently. And finally, number 4, acid reflux. Anxiety can also contribute to the exacerbation of acid reflux symptoms, including throat irritation. The association between anxiety and reflux is complex, as anxiety can both contribute to acid reflux and be the result of the discomfort caused by the reflux symptoms. Here we are again, right? With the chicken or the egg, the cycle. Which comes first? Doesn't matter. We're going to work on it with what we can do. So managing anxiety and stress is key to reducing throat symptoms related to anxiety. Techniques such as relaxation exercises, deep breathing, mindfulness, and stress reduction strategies can help alleviate symptoms. In some cases, you might need more help, such as seeing a coach or a therapist, to help you address the underlying anxiety issues. So, in my research of LPR, once I knew that's what I had recently after all that coughing with COVID, I think that's what triggered it. I saw so many people who were struggling with anxiety when I was researching and joining groups in Facebook and reading what other people were dealing with. And so it really was the chicken or the egg, because a lot of people on those sites were extremely anxious. And I mean, I didn't feel anxious. I just wanted to figure it out so I could take care of my throat without having to take medications that were not really going to do much help anyway. So what we do know is that everything goes better when we're calmer. So if we have something going on, it's okay. We can figure it out one step at a time. So here's a little background on LPR, and I currently have a client in the middle of this Globus LPR struggle, and so I know there are others of you out there who may be wondering about these sensations and symptoms. So the LPR, which is a medical condition characterized by the backward flow of the stomach acid into the larynx, which is the voice box, and the pharynx, which is our throat. It is also known as silent reflux. In a healthy individual, the muscular valve called the lower esophageal sphincter, or the LES, prevents the stomach acid from flowing back into the esophagus and throat. However, in LPR, this valve may not function properly, allowing the stomach acid to reach the sensitive tissue of the larynx and pharynx. Acidic substances such as gastric acid can irritate and damage the delicate tissue in the larynx and pharynx. The acid can cause inflammation, swelling, irritation, phlegm, leading to a range of symptoms. And these symptoms may include, and these were things that I definitely had when I am not following a healthy LPR way of living: hoarseness or voice changes, chronic cough, throat clearing, sore throat, difficult swallowing, feeling a lump in the throat, postnasal drip, and chronic throat irritation. Now, I didn't have all of these. I only had a few of them. But I will say that we don't need to have all of them. And some people with anxiety have some of these also that don't have LPR. So the acid from the stomach can also affect the lining of the esophagus and cause GERD, the gastroesophageal reflux disease, which is a related condition involving acid reflux into the esophagus. However, in LPR, the symptoms primarily manifest in the throat and larynx, rather than the typical heartburn symptoms associated with GERD, hence the name silent reflux. It's important to note that LPR is a chronic condition that requires medical diagnosis and treatment. And yes, I was diagnosed, but I kind of treated myself because I saw there were lifestyle changes and dietary modifications and voice therapy techniques that could be used to manage LPR and reduce the impact of the acid in the affected areas. And I thought that's a great place to start. And as it turns out, that was the magic for me. But I want you to consult a healthcare professional for proper evaluation and personalized treatment for your individual situation. These LPR symptoms and sensations can be very triggering if you're not aware of what is happening. And I deal with this with clients all the time. If we don't understand what's happening, it's more frightening than when we do understand where this is coming from and what we can do to walk ourselves out of it. So if you're not aware of what's happening and you are building up more stress, fear, and anxiety, it can be a part of the LPR cycle, as noted with many who are struggling with it. So while the LPR is primarily a physiological condition caused by the backward flow of the stomach acid, it's important to note that anxiety can potentially exacerbate the LPR symptoms in some individuals. Anxiety and stress can contribute to the development or the worsening of acid reflux and LPR symptoms through various mechanisms. Firstly, anxiety and stress can affect the function of the lower esophageal sphincter, the LES, the muscular valve responsible for preventing acid reflux. Stress and anxiety can lead to an increase in muscle tension, including the muscles around the LES, potentially weakening its ability to effectively close off the esophagus. So you see, we always do better when we can begin to remain calm or start walking toward calm, beginning to go there by practicing our mindfulness and be willing to do our breathing, taking time out for ourselves. Because when we continue to pile more stress on top of something that's already disturbing us, we are causing it to become greater, to become more of an issue. Next, anxiety can contribute to changes in the digestive patterns and habits. It may lead to increased gastric acid production, altered gut motility, or poor eating habits such as rapid eating, overeating, or consuming foods that trigger acid reflux. These factors can further contribute to acid reflux and LPR symptoms. Now, finally, anxiety can cause an individual to become hypersensitive to physical sensations. I know this. I was a hypersensitive person to every physical sensation that was in my body back in the day. I am not so much now. Actually, sometimes I think I'm not as keenly aware of what's going on as I even could be. But I used to think every gas bubble was a heart attack. I could feel everything. I swear I thought I could feel the blood flowing in my veins. I just was so clued into my body because I was anxious. I was afraid that something was wrong or would go wrong. So anxiety can cause people to become hypersensitive to our physical sensations, and this heightened sensitivity may lead to increased awareness of LPR symptoms, making them feel more distressing or prominent than they actually are. This is where we want to remain calm. We don't want to have such an increased awareness of symptoms and sensations that we start blowing them up even bigger. It's important to note that anxiety alone does not directly cause LPR, but it can play a role in aggravating symptoms and making them more bothersome. Managing anxiety through all our tools and practices of stress reduction techniques and relaxation exercises can be beneficial in reducing the impact of anxiety on LPR symptoms. As always, it's important to note that if you experience persistent or severe throat symptoms, it's recommended to consult with your healthcare professional just to rule out any other underlying conditions and receive appropriate guidance and support. So for my people out there who are currently struggling with the Globus sensation, with these other possible symptoms, having chronic cough, feeling like you're always clearing your throat, having difficulty swallowing, the old lump in the throat, or the postnasal drip. That could be a symptom of, like what I'm struggling with off and on, not so much today, LPR, or it could be anxious symptoms and sensations from being hypersensitive to what's going on. Because if we start swallowing more, we're going to start having more difficulty swallowing. It's one thing leads to the other. And the best thing we can do is to remain calm, to bring ourselves back to center, remind ourselves that we are okay right here, right now. And once we get the clear that our throat is fine. I mean, back in the day, I had nothing wrong with my throat. I would have my throat looked at. There was nothing wrong with me, but I had more symptoms and sensations then than I did now or recently, a few years ago, with the LPR, when it was actually something that was going on with me. So we don't want to use our mind to add to the stress of a physical symptom or sensation. We want to stay neutral with it. We don't want to ignore it. We want to get the proper help because it may be something physical that we find out if we do these 3 things, like I made some lifestyle changes and boom, started getting great results. Well, that's what we should be doing. But we don't want to worry about it. We don't want to be afraid of it. We are okay right here, right now, and we're going to take the very next step. So I hope this has been helpful for you because I know it's a struggle. I remember feeling like if I could just have my throat not have a lump in it, my life would be so much easier. And that's true. But that lump wasn't there. That lump was from my tension in my own throat. So if you have that kind of tension landing for you, do the practices we talk about here. Remain calm. Bring yourself to the present moment. Let your muscles relax. If you can practice progressive muscle relaxation, that throat will follow suit. It will also relax. So again, I hope the show was helpful for you. I'd love to hear from you if you have any more questions about this issue. And I hope those of you that are out there that I know are struggling with this issue can come back and listen to this show so that you can remember that these sensations happen. They can be happening from our anxiety. They can be happening from our LPR. For me, but it's not a life-threatening thing, so I don't need to be scared and frightened and adding more stress to my plate. I'd love to hear from you, and you can send email to anxietycoachespodcast@gmail.com. And now for today's quote. You must learn to let go, release the stress. You were never in control anyway. And that's from Steve Maraboli. I'll be back in a few more days with another podcast. Until then, be well and aloha.
Thanks so much for joining us for today's episode of the Anxiety Coaches Podcast. Find more information at theanxietycoachespodcast.com.